Good morning, everyone. This is Dawn Miller with the Healthcare Authority Division of Behavioral Health and Recovery. We have Paul Phares here again today. Part 3 of what I'm hearing is a wonderful series. Sadly, I haven't been able to listen in, so I'm excited to be able to listen in today and hear what Paul has to say. I've gotten some feedback that the other 2 were great. So we are anticipating, I think, a few more folks, so we're going to wait until about 5 after to get started. Just to allow other people to log on in case they're having difficulties. Thank you for being here today, and we'll talk to you in a couple of minutes. For those of you that just joined, we're giving a couple more minutes for people to log on, and then we'll get started. Good morning again, everybody. For those of you that just joined, thank you for attending the part 3 of the Technical Assistance on Fidelity Principles. Paul is here with us and is going to start the presentation here in just a moment. I want to give him time to be able to share his screen and get slides going and that kind of thing. For anyone who has been unable to see the other 2 presentations, they are recorded and I can send them out to you. We'll be sending out information from this one probably in the next day or so once the recording is finalized. I see Paul is starting to share his screen, so I am going to turn it over to you, Paul.
Thanks very much.
Well, I don't know if you're talking right now. I'm not hearing any talking. I hear an odd little noise. Oh, there we go.
Now?
Yes. I should say yes for just half a moment.
Interesting.
Audio seems to be a bit of a problem. You know, it's interesting to me, and I'm kind of just talking, waiting for Paul to be able to speak consistently and clearly. I know I was in a meeting earlier today where Carrie Waterland said the dumpster fire that is 2020, and I told her I was going to steal that because I kind of loved that. And one of the things that we're all finding, sadly, is we're in a lot of webinars, we're in a lot of you know, virtual presentations in which we have either audio or video difficulty, and I think we've all learned a great deal of patience, kind of because of having to deal with those things. So I guess I'm going to ask if somebody would type in the chat, can you hear me?
Dawn, I can hear you. This is Paul.
Okay, and now I'm hearing you clearly. So hopefully that's a continuing thing.
I switched out to my backup headphones and mic, and so I'm just going to pretend that these will work forever, and maybe I'll throw away the other ones.
There we go. I'm liking that idea.
Yeah,
all right,
for sure.
Over to you.
All right, thanks, Dawn. As I was saying, and you probably didn't hear, it sounds like, my name is Paul Phares, and I'm working with Dawn and HCA through Public Consulting Group, my employer. We're trying to bring IPS supported employment services to the state of Washington. And so what we're doing today is, I don't know that anybody formally called what we're doing today this name, but this is what I'm calling them. We're calling them IPS provider sessions. And so we've had 2 already. This is the 3rd. And what we did, just for context, Dawn and Darren Paschke kind of shared some, I would say, generalities that they were noticing during Fidelity reviews in Washington with me, and we talked about common themes and patterns. And so we put together some content to really target where it seemed like Washington IPS providers might be having some difficulties or you know, have opportunities for improvement. So for today, we're going to talk a lot about IPS supervisor documentation and how it relates to Fidelity. It's kind of a strange thing today because in some ways it's a really complicated topic, but in other ways there's not a lot to it. So I think I want you just to really kind of sit back and think about how this applies to your organization. I want you to think about how there's not a, you know, canned text or one size fits all solution for every agency. This is really going to have to be you conceptualizing what we talk about and thinking about how it could work in your organization. I'll show you some examples of other organizations' solutions for their agency. You might be able to steal a good idea. Don't reinvent the wheel. I'm the first one to say that out loud. So if you see something today or you hear something today and you think that could work for us, my best advice to you is try it. You know, try it for 30 days, 60 days, 90 days, see what you think. If it's kind of good, but you still need some other tweaks, you know, we can make those tweaks. We can talk about those too. And if you're somebody on the call who has no problems with IPS supervisor documentation for Fidelity, that's good too. I've got some spots plugged into our slides today where you have an opportunity to kind of share what you do, because it's one of the great things about IPS is the kind of collaborative learning community feel of all of the IPS providers. So like I said, if you've got it figured out or you feel like you have it figured out, by all means, please share your good ideas because folks want to hear them. Real quick about our format today. The last 2 sessions, the way we've done this is I'll be talking in blocks about an hour at a time, and we'll take a break at the end of the hour, 5 or 10 minutes to do whatever you need to do. And then we're going to break at noon for lunch for about 60 minutes, and then we'll come back and do a little bit more content. What I'll tell you is while I can talk for all this time. I would prefer it if it wasn't just the Paul Phares show. Whether that's us unmuting you or whether it's just typing your questions in the question box or the chat bar, all of those are fine options if you have things you want to ask or things you want to say. I try to keep a good eye on the chat bar too, so if you do type a question in there and I don't answer it immediately, I will get to it. I just try to make a little space in all of the content for that. So without any further ado, let's go ahead and get started. I always like to put this context slide in just to kind of put out there that, you know, the stuff I'm going to talk about today is not specific to the state of Washington. We're going to talk more about what's specific to the IPS Fidelity Scale. And so when I show you an example from another organization, that would be a best practice or what I would consider to be a common approach. And it would be only items I would show you from agencies or organizations who have had kind of a full implementation of IPS supported employment and have been shown to have good outcomes. And most of what I'll talk to you about today is Fidelity Scale driven. And I realized in my kind of introduction, I left out probably the biggest portion of, you know, maybe why I have some ideas that I could share with you today. So when I'm not working with Public Consulting Group, I work at a community mental health center in Illinois, where we have an IPS program, and we've had an IPS program since I think it's 2006. I was an IPS supervisor for a period of time in my career there, and now I'm a member of the executive team, and certainly still committed to IPS at the organization. And when I'm not doing that, I'm actually working for the state of Illinois as a certified IPS fidelity reviewer. And so that sees me going to other organizations across the state of Illinois and being part of the fidelity review team. And I've had some experience doing fidelity reviews in a handful of other states as well. So I've seen a lot of ways that organizations have kind of solved the IPS fidelity problems they're having. And so I'll be sharing some of that with you today. So I want to just kind of right out of the gates start and just kind of hear from you. I see on the attendees list a lot of names that I saw last time, which is great. So we kind of have a cohort going here. So I guess I'm interested in hearing from you all, and just type in the chat box or in the question field. What is it about IPS supervisor documentation that got you interested in even attending today's session? And then I'm just kind of interested again to hear from you. What do you hope to learn by the end of today? You know, some people would probably answer that and say, well, just give me the playbook and I'll go. Or so I'm just kind of curious from you all what you're hoping to get out of today. And I'll wait just a couple minutes while those answers roll in. I think I learned in the last two sessions that there's a slight delay in you entering questions and me seeing them. So I'm going to wait just a little bit. I learned my lesson, I think, last time that I should wait a little bit. So just wondering, what is it about the supervisor documentation that made you think I'll go see what Paul has to say, and what are you really hoping to learn by the end of today?
And while you're doing that, I'm going to do a commercial announcement. How about that?
Perfect.
Those of you that have been kind of doing the service for a while know about fidelity reviews and the fact that the state of Washington has incentivized them. So we have offered an incentive for agencies to either host a review as a baseline, so first one, host a review as a follow-up if you've already had a baseline, or send people to be part of review teams. And we're going to be doing that again for 2021. We're starting to reach out to agencies at this point in time to ask if anyone's interested in being a reviewer, hosting a review, being in some fashion part of that process, and receiving an incentive for doing that. I don't know the amount of the incentive in this upcoming year. Things, as everybody knows, have been in kind of an upheaval, including finances, and so we'll have to see what that ends up being. I obviously will get that information out to you later. But if anyone has an interest in being part of a fidelity review, please shoot me an email at dawn, miller@hca.wa.gov, and I'll give that again later so that folks have got it. And I wasted enough time now, Paul, that you've got 4 questions.
Yep, not a problem at all. So what I've been doing is just I go through the questions, Dawn, just so you know, and just try to answer them out loud or respond to them in real time here. So we've got one question here where someone's building the program and they just started in supported employment themselves, and so they're really hoping to learn what they need to kind of set up for success. So that's great. I think we'll be able to help you do that by the end of today. And again, just a reminder, a lot of this is going to be your choice, what you implement. So I just encourage you to kind of take what you can from what we show you today, and really remember that you have to make it work for you. You know, every agency at a minimum has their own sort of documentation system, and I think we talked last time, some have electronic medical records, some have paper records, some have a combination of both. You know, so just that alone ends up being some tracking problems because information is in multiple different places. So, you know, make it work for you. View what we're talking about today as ways you could do it and as a guide. I think you'll be just fine. Another who's just setting IPS up and hoping to learn how to go about documenting properly. I have to get rid of these answered questions already. Okay. Everything, so that's a good one. May says, you're here to learn everything. That's great. We can, I don't know if I can teach you everything, but we'll figure something out in between the two. Guiding better practices for job development activities and strategies. That is a great thing to hope to come out of here with today. We'll talk about job development in relation to the documentation and tracking. If you want specific information on job development, I believe that there has been, I think, 2 webinars on job development activities and strategies, and Dawn may be able to point you to those. Dawn, you may have those archived on the website or something. Lack of consistency with completion of documentation. Yeah, that's a big one when you go into an organization as a Fidelity reviewer. One of the things that you become really aware of right out of the gates on the morning of day 1 is whether the organization has kind of consistent documentation. And as you might imagine, that is something that you know, when you're scoring a Fidelity review, you know, that's part of it. Let's put it that way. That's part of it. So I'm going to leave that question about sharing the links on job development, and I'll work with Dawn probably offline to make sure that what I said is accurate, that we have done some job development in the past, but I'm pretty sure we have. Okay, great. So that is also, just so you all know, my little secret way to make sure that the questions bar is working when I do a webinar. So how about that? Now you know my secrets.
All I would mention too that if there's enough interest in job development, we can do a virtual job development training for agencies. We haven't done that. We used to do it about quarterly. Just for lots of reasons, we haven't done that recently. So if there's an interest in that, you know, we can go ahead and set up a virtual job development training. And in fact, the more I think about it, it's been a long enough time that I think, in fact, we will do that.
Okay.
And that makes folks. And we'll include the piece about how to do with, you know, with the advent of physical distancing and that kind of thing. And saying, yes, please, we'll do that.
We'll make it happen. Job development is a hot button topic for sure in IPS. It is something that's on everyone's mind, especially this year. So hopefully some of this is review. You know, one of the challenges I have when we do these is the folks who are attending typically are just kind of this gradient of beginning of implementation, middle of implementation, and full implementation. And so it's difficult to provide content that doesn't omit information that everybody could take advantage of. And so if this is a review for you, I apologize. it's just something I feel like it's worth just putting out there. So I like to kind of walk people back to what are we all doing here? What's the point of what we're doing? So we're not talking about just a score. We're not talking about just a number. We're talking about the fidelity to a evidence-based practice for supported employment. And so when you're thinking about fidelity, I really encourage you to think about it for what I would consider its primary use, which is to improve the quality of your services. It is necessary, the Fidelity Scale, in all phases, whether you're beginning implementation, whether you're right in the middle of implementation, or whether you've been doing it for years. And it's great for training your employees. So, if you have copies of the Fidelity Scale available at your organization, great, share them widely with your employment team. If you don't have copies, I would encourage you to go to the ipsworks.org website, where you can get access to the whole document library for everything IPS, including the Fidelity Scale and the Fidelity Reviewer's Manual. So that's like having the teacher's answer guide, when you're in elementary school. That shows you how a fidelity reviewer regards each fidelity item. And I say it every time Dawn invites me to a training, that if you are doing IPS and you don't have the Fidelity Review Manual, you need to stop what you're doing and go grab it real quick. It's free. It's a big print, so if you're going to print it, it is many, many pages. But if you just save it electronically or something, that's fine too. But it is very, very useful. And to this day, when I have a question about something fidelity related, what I do is I go to the Fidelity Review Manual and see what the Fidelity Review Manual says. And 9.9 times out of 10, there's at least a sentence in there that tells me, some direction. So I encourage you to grab that and pull that down. It's really, really important. So just some orientation to the Fidelity Scale. Of course, it's 25 different items. Each item is rated 1 to 5. And you put all of those 25 individual item ratings together, and it corresponds to an overall fidelity rating, like a cumulative score. And they fall in the range of fair, good, or exemplary fidelity. And the idea is you have a fidelity review every year to help you understand how closely you align with the Fidelity Scale. So the first thing I'll say, and Dawn's heard me say this a million times, so Dawn, you can take a quick nap or something while I say this. Once you get into the range of fair fidelity, you have fidelity to the model. So I always caution organizations against point chasing for fidelity. It's less about the points and more about your quality. So once you get a score of, even at the very lowest level of fair fidelity, let's say 70, 75, you have fidelity to an evidence-based practice. Sure, it's at the lower end of fidelity. Sure, there are things you could improve, but you have fidelity. So don't beat yourself up about a score that's lower than you'd like. Instead, if you feel like your score is lower than you'd like, you can take that fidelity report that you get from your fidelity review, and you can turn that into a fidelity plan. And what you can do then is, over time, you can increase your score by working on the things you did not get all the points for. And a lot of that is things you have direct control over too. That's the first thing I'll tell you. In our first provider session, we talked about two of the hardest things for organizations to really get going when they start IPS are the items that are relationship-based and hardwiring IPS within your organization. Relationship-based items in the Fidelity Scale, like collaboration with vocational rehabilitation, those are difficult because it takes another stakeholder to kind of meet you halfway. Anytime you have a relationship, that's the way it is. And then hardwiring it into your organization is difficult because often all of us, in human services, we're asked to do more and more with less and less every year. And you're basically, your IPS program is competing with multiple priorities in an organization, other programs, other things, other streams of revenue coming in. And so it can be really difficult to position IPS as a forerunner in an organization when you're first starting out. So with that first or second fidelity review, take the information in stride and don't beat yourself up. It's not worth it. All you can do is focus on what you have control over. When I was setting up this presentation, I think I had about 4 different versions of it. And one of the challenges with this is I don't think there's a really clear way something I could point to that says this is, here's the one sheet or the one pager that says if you do these things, if your IPS supervisor does these things, you'll have great fidelity. There's nothing quite like that out there. There's a lot of ideas, and more often than not, what you find is you have a lot of words to describe what a supervisor could track, but they don't really talk about how you could track it. So one of the challenges you have is I better get rid of that little thing there. One of the challenges you have is that you know what to do, or you have an idea of what to do, but there's really no playbook on how to do it. So what I decided to do was really split this up into actual fidelity items, go through the fidelity item briefly, and then talk about what's out there, or how you could track that fidelity item in a way that would set you up very well for the fidelity review. And at the end of it all, the fidelity reviewers can only really rate you on the evidence that you produce while they are present. So if you say you have weekly team meetings, but they're not able to observe a team meeting, and there's nothing you can produce that tells them you have weekly team meetings, they might have a difficult time scoring you, in a really, what's the right way to put it? They might have difficulty scoring you in the best way because there's nothing to point to as evidence. And so that's kind of the rhyme and reason behind what I'm trying to do today. And so, for example, caseload size. I have my Fidelity Reviewers Manual out as well while we're looking through these things. This is an example of an item that looks really easy, sounds really easy, and should be easy, or could be easy, but you'd be surprised how many organizations really struggle with it. So in the Fidelity Scale, under caseload size, it says employment specialists have individual employment caseloads, and the maximum caseload for any full-time employment specialist is 20 or fewer clients. Seems pretty straightforward. It's important for you to know, one of the things I added in here that I don't know if we've talked about with a group in Washington before is kind of the methodology of the scoring. So for this one, the reviewers would average all of the employment specialists together and then divide by the number of full-time employment specialists. So, first of all, I like bringing methodology to this discussion because, first of all, there's a little flexibility there. So at the top, it says there's 20 or fewer clients per employment specialist. If you have somebody who has 22 and another employment specialist that has 15, if you follow the scoring methodology, that average will be 20 or fewer, and you'll be fine. So you have some ability to be above 20 as long as the average works out. And so it's just a different way to think about it than most places that I talk with. There are places that they have this down to a science. They get the kind of methodology of the scoring, but there are many others who really struggle just with the number of clients per employment specialist. And what I've seen in best practices for collecting data, and really it's important for me to say right out of the gates here that I'm putting all of these items in this presentation today because I think these are the items that the IPS supervisor really needs to kind of have their thumb on in order to have good fidelity. Knowing these things will help the IPS supervisor know, at least preliminarily, where I'd say within a 5 to maybe 8 point range where their fidelity will be when they get a fidelity review. So the best practices in data collection really come down to some sort of case list or client list. Each organization calls it a little something different. And another best practice with those lists is that they go in and score it the way it would be scored in a fidelity review regularly. That might be quarterly, it might be every couple months or something. That frequency you can figure out with what works for you. But one of the common pratfalls here for this item is organizations get mixed up in their own language, and they produce a case list. Let's say it has 29 people on it, and the reviewers look and say, well, that's over 20 certainly. But then the agency will say things like, yeah, but those 5 people are in closed status. These 4 people are in interrupt status or outreach status. So really they're only working with 20. So what I would also encourage you to do, and it's not a best practice, but it's just a way for you to kind of make sense of your own data, is to produce the open and active people who are your employment team is working with. When I look in the Fidelity Review Manual, let's see here. So there's some guidelines with programs who keep people on caseloads even though they don't meet regularly with them. So a person who receives monthly outreach attempts, even if the outreach attempts are not successful, is considered to be on an IPS specialist caseload. The person who receives monthly services from the IPS specialist is considered to be on the IPS specialist caseload. A working person who calls the IPS specialist occasionally to say hello and just provide a quick update is not considered to be on the caseload. And it says here, the IPS case should be closed after 3 months without services or outreach attempts. For example, when someone cannot work for 6 months because of a medical problem, the person's case is closed from IPS and is no longer on the caseload. And the last bullet point, which I think is also important, people referred to an employment specialist, but the employment specialist hasn't yet met with them, would not be considered on the caseload. So I only say that, and I'm not going to go through the gory detail of every item like that because we only have a handful of hours. But it's just important to kind of set the tone that if you look at the Fidelity Review Manual, you'll understand the science of how each item is scored, which is why I really, really underscore the importance of each IPS supervisor. Even if you just took, let's say, 10 minutes in your IPS weekly team meeting, your IPS team meeting, if you took 10 minutes of that time every week and you just reviewed 2 items in the Fidelity Scale in the Fidelity Reviewer's Manual, you'll come away after the 1 month, you'll come away with a lot more knowledge than you would guess based on how the Fidelity Review Manual is structured. The next item in the Fidelity Scale is employment services staff, and this is employment specialists providing only employment services. So kind of the rationale behind this is that if you're an employment specialist and you also, let's say, half time do case management, we know that when there's a mental health crisis or something like that, that's going to take precedent over any IPS work. And so really creating specialists on the IPS employment team that only do employment. And the way this is scored, the methodology is it's just an average of the employment specialist's time spent on employment compared to the anchors in the Fidelity Scale. The easiest way that I've seen people solve this problem is they literally create the space for their employment team to do 100% employment work. They don't allow for case management or counseling or crisis work. They have other resources in their organization to do that work. And when that comes up with the employment specialist facilitates getting the client to those other resources to make the clean handoff, if you want to think about that. So the second bullet point is Excel, Microsoft Excel or Google Sheets. I'm not endorsing either one, and there are many others that you could use. But if you are someone out there who if you're an IPS supervisor and you don't have a real intimate knowledge of Microsoft Excel or basically spreadsheet, how to record data on a spreadsheet, both Excel and Google Sheets are very easy to use, very easy to learn. There's multiple videos online and on YouTube and every place where you could just probably end up getting the basics learned, and you could go a long way towards recording your data in one place in a way that really helps you at a glance identify and produce in a fidelity review the evidence for any of these items that we're talking about. The other thing is EMR, that is electronic medical record. So you heard me say earlier, some organizations have an electronic medical record, some do not, some have a hybrid of electronic medical record and paper charting. It's less important which you have available to you and more important that you know the best way to use it. So, for example, often electronic medical records come with them as a feature, some sort of data mining or report running features where you could say, you could select your employment team staff and it would shoot out a report of everybody assigned to them in the medical record. So that's pretty easy. And again, every medical record is a little bit different. So the problem then runs into if your employment team isn't fully integrated into that electronic medical record, that's when maybe you would need Google Sheets or Microsoft Excel to try to manage some of that data without the electronic medical record. It's tough. I feel like it's difficult for me to describe accurately, and I do have examples later that I'll show you of how some other places have done this. But if it's just for this item, employment specialists provide only employment services to the degree that you can. The absolute easiest way to do it without having to manage any data is to just have your IPS team only do IPS services. That is what I see more often than not for agencies that are high performing. Vocational generalists is the next item in this section. And this is basically saying that each employment specialist does all of these phases of the employment services. The scoring methodology is important for you to know, like I said earlier, because you're going to score each employment specialist. You're going to average them all, and the important thing to remember here is the score is rounded down. So if your employment specialists end up, if the average ends up being 3.6 in a Fidelity review, you don't get a 4, you get a 3. And so it's important for you as a supervisor to understand that just that little rounding down portion and how it impacts your score, so that you can kind of make the necessary adjustments. And this is another one where the best practices, the easiest one is to just have your employment team do all of these phases. Intake, engagement, assessment, job placement, job coaching, and follow-along supports. It is literally the easiest. I know if you're somebody who is part-time employment and part-time something else, that's not always easy. But if you have the luxury of full-time employees devoted to employment specialist work, that's the easiest thing you can do. And this is another one where, if you need to track it, Microsoft Excel, Google Sheets, or any of a million different apps that are out there can be really helpful in helping you put all that data together. I'll show you later a spreadsheet that an organization uses that has multiple tabs, and they have integrated the Fidelity Scale into the Excel spreadsheet so that, and the way they do it is each employment specialist manages their own spreadsheet for their own cases, and every week they report that to the supervisor, and every week the supervisor then merges all of the employment specialist data into one kind of master document. And they use it to track everything, as you'll see. Again, it can be very powerful, but these are systems you'll have to put into place if you don't already have them. And then I'll also put here electronic medical record reporting is another way to leverage technology. If you have an EMR and your IPS employment team is fully integrated into it, their documentation is fully integrated into it, there may be a report that you can either create or one that's already created that you can run that would show this to Fidelity reviewers when they arrive. And so just a tip for if you're in an agency and you're not maybe sure who to ask about those reports, most organizations that I have seen have some sort of system administrator or support services manager or director who is kind of in charge of the medical record. Those are good places to start the discussion about, I need a report for A, B, and C. Can you help me either create it or find if there is one available to us? The tricky part there is if you have to do any changes to your medical record to create a report, some medical record companies charge you for that. And so that is just something to think about in the background there. So now this is Paul's turn to hear from you. So again, in the questions field, I'm just kind of curious from you, what kind of methods or tracking processes do you currently have in your program? If you're an IPS supervisor, what do you feel like are your blind spots? And blind spots would be, what are the things you don't know how to quantify it? What are the things that are occurring that you don't quite know how to quantify? And while I'm waiting on a couple answers there, I'm going to step away for a quick second and refill my water so I don't start coughing with a dry throat here. Give me 1 second. Okay, I am back. That's much better. So we've got our somebody who's answered here. Our program is currently using the IPS tracker. That's good. And then we've got another answer that folks are using their electronic medical record and Excel. And they say they're the supervisor, but they don't have staff right now, so they're just tracking themselves. So that's good, but it's also a good time for you to focus on getting systems right and put together in a way that when you have more staff, you'll be able to track all of those moving parts. That is another sort of challenge for supervisors. Often if they have one employment specialist, the tracking system is going very, very well, but once they start to add a second or a third employment specialist, it just gets to be a real challenge for them to manage all of that data. So get it right and get it refined right now while it's easy, so that when it gets a little bit more difficult, you'll have some good systems in place. Another one, because it's so new to us, blind spots for everything is what May had said, because it's so new to us. And yep, I was there, I've been there, and it gets better, trust me. So if we move to the next section in the Fidelity Review, I see another question came in, hang on. We've got another one, Catherine, using the Excel tracker. So that's good. In the next section, the organization section of the Fidelity Scale, this is where the Fidelity Scale really moves into what I would consider kind of overarching things. They're really things related to the way you've got IPS set up in the organization. These are items that are reflective of kind of systems you have in place. And so it's not until we get to the end in the services section where we really start to track data regarding what your IPS team is doing. And Jason chimes in here by saying the blind spot is tracking nuances in services for placement, caseload, job development, and client gained employment versus employment specialist assisting. Yeah, those are all, you're probably right where you need to be, Jason. Those are all the things that make you want to shut your computer down at the end of the day and just forget about it all, probably. So again, back to the organization section, got a little org chart there because one of the first things I mentioned to IPS teams is that just having an org chart available for Fidelity reviewers can be very, very helpful in many, many ways. So the first one is through team assignment. So this is employment specialists being part of up to 2 mental health treatment teams from which at least 90% of the employment specialist caseload is comprised. This is another one where you score each employment specialist individually, and then you average all of them together. And this is another one where you need to make sure that you round down. And the rationale behind rounding down there is you would only want to give credit to the highest score that an organization has fully achieved. So in the example I used earlier, if you had a 3.6 and you rounded up to a 4, you'd really be giving credit for things that the agency hadn't fully done yet. So you need to round down because 3 is the score that they most fully meet, if that makes sense. Those case lists and client lists that we talked about earlier are best practices in data collection for team assignment, and for getting them and tracking them regularly. The same sort of thing is useful here. I'm looking through the Fidelity manual right now. And this one, you know, if you look in the Fidelity Review manual, one of the things that sticks out to me is they have so many examples of how the scores could work. And it's just important, again, for an IPS supervisor to understand how each of these items are scored, so that they can kind of know the boundaries of the rule, if that makes any sense. This one, though, for the most part, pretty straightforward. You could, I'll leave it at that. Yeah, for the most part, this is pretty straightforward. The other thing I struggle with, by the way, with this content is I feel like we could probably spend 45 minutes in each of these items, just really talking about the ins and outs of each of them. But for today's purposes, I think we're going to try to cruise at a little higher altitude, just to really kind of understand the lay of the land for some of this data collection. So if you have specific questions about an item, please let me know. We can get to it. The next item in this section is integration with the treatment team through frequent team member contact, and this is the one where we expect the employment specialists to meet weekly with the teams. The offices are in close proximity. The documentation is integrated into a single chart. Employment specialists help mental health teams think about employment for individuals who have not yet been referred. And the scoring methodology is this is an item where each of those statements that I just read to you are a component, and for each component that you meet, you get a point. And if you get all 5 components, you get 5 points. And this one's a really tough one. There's no Excel spreadsheet or anything like that that I could point you to. The best practices to kind of collect this data and have it available in a Fidelity review really end up being meeting agendas or meeting minutes, or both, if you have both, from treatment team meetings. I go to many agencies and they have a treatment team meeting and there's no agenda, and that's not wrong, but you could see where in a Fidelity review, even if you observe the treatment team and they say, oh well, we do it weekly and it's, you know, shared responsibility, it's still difficult to give credit without hearing something more specific to this last clause. Employment specialists help mental health teams think about employment for individuals that have not yet been referred. So you know, if you want to try to put something like that in the agenda, or have a way to kind of highlight that in your agenda or your meeting minutes, it would show up in your meeting minutes, then that would be a great way in a Fidelity review to ensure that the reviewers understand the work that your team is doing. Another one that is going to be kind of the same answer is this collaboration between employment team and vocational rehabilitation counselors. So in this one, the Fidelity Scale discusses how the employment specialists and VR counselors have frequent contact for the purpose of discussing shared clients. And really, the scoring methodology, for being so simple on the front end, the scoring methodology really ends up being a little complicated. Let me get my Fidelity Scale out. In the Fidelity Scale, you would get 5 points credit here. Goodness, I can't quite turn to the page all of a sudden. The narrative for 5 points on this item is the following. Employment specialists and VR counselors have scheduled face-to-face meetings, at least monthly, and have client-related contacts, in parentheses, phone, email, in person, weekly to discuss shared clients and referrals. So you could see where, even though this is simple, the employment specialists and VR counselors have frequent contact for the purpose of discussing shared clients. Being able to kind of show in a fidelity review that you have scheduled face-to-face meetings, at least monthly, and have client-related contacts weekly to discuss shared clients and referrals. You could see where, without something like a meeting agenda, meeting minutes, even if it's the same agenda for 2 years, it's going to be difficult for you to kind of show definitively that this is happening. Sure, the vocational counselor, they may say we meet about once a month, or we meet, I don't know, maybe a week, maybe every week, maybe every other week. Even those answers start to get a little wishy-washy for fidelity reviewers. And so if you're a supervisor that really wants to try to lock some of these down, these meeting type items, the meeting agenda and meeting minutes are the absolute best way you can do it. It sounds simple, it sounds corny, I know, but again, most organizations that I've been to that have really, really high fidelity or exemplary fidelity, when you arrive as a fidelity reviewer, what they present you with is, several binders, and these 3-ring binders have things in them like meeting agendas for the last year, meeting minutes for the last year, et cetera, et cetera. So it's just one more thing you can do to ensure that the reviewers see it while they're there. And I know it can be a little tedious, but I think we talked in the last meeting, our last provider session, the way that organizations kind of handle this is when they get into one of those meetings, they assign a timekeeper and they assign somebody to take notes. And I think the expectation then is that the timekeeper keeps the conversation going and gets them out of there on time, and that the note taker is the one that produces the minutes. So it doesn't have to all be on the supervisor. That can be a rotating thing. Again, back to what I said from the very beginning, make it work for you, because it's got to work for you in order for you to sustain it, right? I am going to just take a look. Okay. Yeah, we'll keep going here. The next item is vocational unit. This is at least 2 full-time employment specialists and a team leader comprise the employment unit. They have weekly client-based group supervision. The scoring methodology, essentially you get points awarded for the frequency of your meetings, whether they're group or individual meetings, and the content of the discussion. Again, popping up here is the fact that meeting agenda and meeting minutes for all past meetings can really save you in a look back type fidelity review. The other thing that's worth thinking about is that org chart. Even if it's, it doesn't have to be professionally done or anything like that. You could put something together in Microsoft Word, but if you think about it from that perspective, it's not just good for the fidelity reviewers, but often that's good as training for new employees too, to have an organizational chart so that people know their chains of command. Something to think about, but again, walking into an organization as a fidelity reviewer that maybe you've never been in before, you can imagine how you're really relying on the IPS team to provide them with all the information they need to make their decisions on scoring. So I'm just trying to tell you about all of the things that will make it as easy as possible for the reviewers to give you the best score, for the work that you're doing. I always feel bad as a fidelity reviewer when organizations tell me they're doing work that meets the threshold of a higher score in their opinion, and my answer in this particular situation, my answer is, but we didn't see any evidence of it. And I never really know what to tell them in that fidelity review, because it's almost like by the time we're having that discussion, it's too late. It's important to think about setting all this up on the front end so that when the reviewers come into your organization, everything is crystal clear and you're getting the most fair score based on the work you're doing. In the role of IPS supervisor here, this is, I'll tell you what, this is a kind of a tricky one. So I've got about 4 minutes until the hour. So I'm gonna just wait a couple minutes here, these next 4 minutes. And what I'll wait for is questions folks might have for me on anything we've covered so far or anything we haven't covered so far too, that's fine. And then I'll just kind of mention that once we hit the hour and hear all the questions, we'll probably take a 10-minute break where folks can stretch their legs or do whatever. I know this is a long time to sit in a webinar, and I appreciate everybody being present. Let's just take a couple minutes. If you have questions or things that are on your mind about anything I've said, or if you want me to go back, this is your opportunity to ask me to do that or to ask your question, and we can kind of go forward from there. I'm not seeing any questions come in just yet. I know, like I said, I learned last time, I believe that there's a little delay. So I'll wait a few more minutes.
And I have no commercial for you at this time.
You don't have a commercial?
I don't have a commercial. I will tell the group that when we got on the call and before we started, I was telling Paul that in Moses Lake, which is where I'm located, it's going to be 83 degrees today, and he was unimpressed with his 50-something degrees that he will be experiencing. So I didn't mean to do that to him. It was it was not my intent, but
unimpressed is a polite way to put it.
I am just
go ahead, Joanne. Go ahead, Dawn. I'm sorry.
Thankful that at least I have no smoke at this point in time, and fires appear to be being managed. And thankful for that, and thankful for the firemen that did everything they did for our state, because we had a lot of the state on fire or in danger or suffering smoke or something. So that part's cleared up for the part.
Scary stuff.
Yeah, it was incredibly scary stuff.
Sure.
I'm fortunate where I live, we weren't close to any fire, but I could see the smoke between my house and the one across the street. So,
oh boy.
Yeah, it was intense, and I don't think my area was as bad as some got. So, See, we have questions.
Yep, we do have a couple. Yeah, it looks like they're both about kind of that org chart that I mentioned. So the first question is an org chart a requirement? And no, it's not. So I am just suggesting it as a best practice to provide clear guidance to the fidelity reviewers. And so there are other items that we'll talk about later too, where an org chart might be beneficial. And so I think it's a good idea for teams to think about an org chart. And most organizations can create an org chart. Like I said, it doesn't have to be professionally done or anything like that. It's just another way to show definitively to the fidelity reviewers that this is the hierarchy. And so the second question is, somebody had to step away for a call, and it says, I'm wondering what exactly the org chart refers to. So we mentioned it in two separate areas, and let me just kind of go back real quickly and show them to you. So we talked about here for vocational unit, where you have at least 2 full-time employment specialists and a team leader comprise the employment unit. Org chart here refers to, just an organization chart that pictorially identifies the IPS supervisor and the employment specialists. And this, if you're an employment supervisor and you have 1 employment specialist, it's probably not as important as if you're an IPS supervisor and you have, let's say, 5 employment specialists, or if you're an organization that has multiple teams of employment specialists. I've done a fidelity review for several years in a row at an organization in Chicago, and they have 11 employment teams. And so they have to have an organizational chart, because otherwise I wouldn't know who I'm talking to. And you know, I mean, at any given time with 11 teams, we're talking about 40 different people probably that are either employment specialists or employment supervisors. So it's tremendous when we walk in and they say, well, here's how it's all laid out. And maybe that's an extreme example, but I think somewhere in between the two is the reality. If you're an IPS supervisor and you've got 2 employment specialists, for example. The other place we mentioned it, well, I guess I'm going to mention it later. I don't think I mentioned it in another place. I think I will mention it later. So yeah, that'll come up later, especially with how the IPS supervisor relates to the executive team. The next question here is, how do we count clients? For example, we have a client return multiple times. Do we count that client as new? And this makes perfect sense. So, you know, you're going to count clients who are open and active. So I think the challenge I have with your question is, you say we have a client return multiple times. I think there's some time frame context there that could be useful in helping kind of understand. So, you know, I like to think about things in terms of like episodes of care. So if I get referred to Dawn on January 1st and Dawn and I try to find employment, and for whatever reason I fizzle out, and after 90 days, Dawn closes me because she doesn't have any contact with me. And let's say I get re-referred that June. To me, in June, I'm a new client to Dawn. Even though I'm not a new client to Dawn, I'm a new client to Dawn's caseload in June because I've been gone for 90 days. And so if she works with me and we get me employed and I'm employed for I was going to say a year. Yeah, we'll say a year. And then she closes me out successfully because I've been employed for a year. And then a year later, I come later. To me, I think that's a pretty brief time frame to be thinking about them as new client, closed client, new client again, closed client again. So again, while I can't tell you what to do, I would encourage you to refer to your organization's policies if you have any policies on closing clients, if you have any policies on things like active cases or inactive cases, and you probably need to, you know, follow whatever policies you have if you have them. And I guess in terms of IPS, what I would tell you is if you keep a client open to IPS that returns multiple times on your caseload, then the risk you run is that in a fidelity review, that person would be counted on the caseload when you're not actually working with them. So I feel like I've given you about a half dozen answers. It's the political time of year anyway, so maybe that's a good thing. But I feel like I've given you a half dozen answers. Hopefully one of them is good and you can take with you as something that's maybe actionable. But I think most organizations that I have been a part of a fidelity review count clients who are referred to IPS and active. And so however that fits into your kind of body of policies at your organization, I think is maybe the best answer.
Paul, one thing that's Washington specific to AmeriGroup, the third-party administrator for foundational community support, asks that agencies not close people unless the person says, I want to be closed. I mean, there is an option to close people if they really say, I want to be closed, I don't want services anymore at all. But if they're in their authorization, 6-month authorization period, AmeriGroup requests that agencies leave them open. And so what we've been doing is looking at them as inactive. We're not penalizing agencies for people that are open simply because AmeriGroup has asked to leave them open until their authorization runs out. Does that make sense?
Yeah, that makes sense. I mean, that's the other sort of thing that we all as providers have to pay attention to is, you know, what the payer source tells us to do. So I did leave that out. I appreciate that context. But yeah, that's equally as important as organizational policies too. And I'll tell you what, it's 5 after. I don't see any other questions right now. So what I would suggest is maybe we break. And what we've done the last couple is we break for about 8 to 10 minutes. And so I'm going to come back a little bit after 10 after and just kind of start my slow start as people get back from, I heard somebody say not too long ago, which I thought was really clever, a bio break, or just to get up and stretch your legs. So I'm going to go ahead and mute myself, but I will be back in just a handful of minutes. So enjoy the break, and I will see you on the other side of it. Okay, we are back. It is about 13 after. So we'll wait a few minutes while others kind of come back from their break as well. And Dawn, I don't know if you're on, but we do have a question that I don't know that I have an answer to. I don't know if you can see it.
I'll take a look here. I didn't have it open. So I see Aaron.
Yeah.
This first hour due to lunch and learn discussion from 10 to 11. Okay, so Aaron, this particular training is optional only, and so it's not really a matter of credit. Paul, for kind of your benefit, we got a new grant where we contracted with various SUD, substance use disorder agencies to hire supported employment staff and gave them seed money. Okay. And part of the contract required 4 different trainings that the agencies each attend to kind of get them up and going related to IPS and providing supported employment services. This is not one of those trainings. This is specifically optional. Aaron, I will say that this is being recorded, and so when we always send out a thank you for attending email after the fact and include documents and things that people have asked for. I will also send out the recording link so that the part that you missed you can still listen to. I hope that answered your question.
That makes sense. Thank you, Dawn. I appreciate it. We'll just wait a couple more, well, about 1 more minute for anybody else. That'll give everybody a good opportunity to grab their Fidelity Reviewer's Manual, right? Hint, hint. Okay, I think I'm gonna go ahead and pick up where we left off. We left off at the role of the IPS supervisor. And this one, it's another component type of item in the Fidelity Scale. And this one it shows that the employment supervisor is responsible for no more than 10 employment specialists. They conduct weekly employment supervision. They communicate with other team leaders to ensure integration. They observe job development with new and struggling employment specialists, and they review outcomes with employment specialists. So the scoring methodology is pretty simple, like other component items. You get points awarded for the frequency of your meetings, group versus individual, and content of discussion. That's not right. I think that's a little typo there. So you're going to get a point for each of the components there that are listed above in the Fidelity Scale section. And so if you think about it, again, back to the organizational chart, employment supervisor is responsible for no more than 10 employment specialists. If you think about the organization I talked to you about earlier that has, 10 or 11 different employment teams, you could see where an org chart would be very vital to try to explain to a reviewer who reports to who and who's on which team. Without it, it's easily lost in the narrative, and then I think maybe you're risking the Fidelity reviewer not fully understanding and not awarding you all the points maybe that you could have because it's unclear. Conducting weekly employment supervision. So in this one, what I would suggest is IPS supervision meeting agendas with meeting minutes. So this one would be on the IPS supervisor. To kind of keep that, you probably wouldn't be doing supervision and put someone else in charge of the minutes. The third component, or fourth component, observing job development with new and struggling employment specialists. There's job development observation logs that are available on the ipsworks.org website that are fine and dandy to record those opportunities and those times. Reviewing outcomes with employment specialists, certainly any notes you have from supervision or outcome type discussions, some of those are performance-based discussions, and so just as a supervisor you might have a performance-based discussion that you would want to make available via electronic format or via something on paper from whether it's minutes or just notes from the conversation. And then the last bullet point under best practices that I put down there is just something to think about combinations of the above. With the exception of organizational chart, I've seen organizations who have IPS supervision meeting agendas that have the outcomes plugged into the form, so that, for example, the supervision might say, one of the agenda items might say job development, and then in parentheses it might say target 6 job development contacts a week per employment specialist. So you've got a way then to kind of integrate some of these items together into the same document. Rather than producing 6 different sheets of paper just for this one item. So I encourage you to think about ways, when you see things like this, ways you can combine them together and really make them work together as a document that has multiple purposes, for example, but also think about it in terms of it's got all of the information you need in one place, is another way to think about it, and it can be very successful. And again, just looking through the Fidelity manual, I think the best recommendation I have is the ability to kind of merge some of those things together into one document in whatever way that you can. And when I say, I went to an agency that did this, for example, there's no special program or anything like that. They have used Microsoft Word, for example, or Google Docs to create these agendas and create these outcomes-based content in their documents. So they're not like electronic medical record documents. They're just, Word or Google Docs documents. So let me go back a little bit. This is kind of an elaboration on questions we asked earlier, but I still am kind of curious from folks. What are things that stand out to you about this IPS supervisor fidelity item? It's busy. There are some complexities to it, and any one of the components, I think, could pose its own challenge to organizations. And so I'm just kind of curious from you, what are things that stand out? And then also, would you say your organization is struggling with setting up these tracking processes versus monitoring these processes, like you already have them set up? Or do you feel like the processes are working fine based on what you've learned today so far? Assuming, I suppose, I try to be very humble, assuming you've learned anything from me so far. So got a question here, are the IPS inspections required and how often are they done? So I can tell you from an IPS evidence-based model perspective, and then I'll have Dawn maybe talk a little bit about Washington specific plans. So IPS as a evidence-based model is similar to, if you're familiar with assertive community treatment, which is another evidence-based practice. It has a fidelity scale, and since it has a fidelity scale, it kind of begs the question, well, how do you know where you're at on the scale? And the way that most states do IPS services is they have a fidelity review at some sort of scheduled interval. I think the recommendation from the IPS Works team, that is the international team that kind of created IPS, I think they recommend once annually is best practice. Also recognizing that depending on what's happening in any given state or region, once annually might not be feasible. So they're done once annually, and some states require them, some states don't. And so, Dawn, do you want to elaborate a little bit on Washington specifically?
I'm going to be very honest, and I walked away for just a second. Repeat your question.
Oh, it's okay. It's one that I know you, it's a slam dunk for you. I know you know it. So the question was, are the IPS inspections or fidelity reviews required and how often are they done? I talked a little bit about IPS in general, and I was just hoping you could talk a little bit about the plans for Washington fidelity reviews.
Absolutely can. The intent was very much what I was talking about earlier in my commercial announcement. We have a number of agencies that have done baseline reviews now, and in the year 2021, we will do follow-up reviews. We have others that we are hoping will do baselines. Truth be told, kind of what we're ending up getting to, just because of bandwidth issues, is that we're doing them about once a year for those agencies that are opting to participate. At some point in time, we are going to make participation mandatory, that all agencies will be doing baseline reviews. Right now, it's a voluntary kind of a thing. And agencies get paid for it. So that's kind of where we're at this point in time.
Thanks, Dawn. My cursor disappeared. I couldn't get off mute. That was weird. That's a new one for 2020, I suppose.
Yeah, it would figure, wouldn't it?
Yeah, that's all I need is my cursor to disappear. There was a follow-up question, Dawn. Does the agency request a fidelity review, or is it a surprise visit? Do you want to talk about Washington's perspective there?
That's a really great question. It is scheduled well in advance. We send out a letter a month or 6 weeks in advance that says, here are the documents we need, here are the interviews that we need to have set up. The letter is taken from, it's adapted from the letter that's in the manual, the sample letter that's in the manual. So you can actually take a look at that now and get an idea of what it would look like as far as the interviews and documents that we're going to be looking at when we would come. It's very much negotiated as far as dates. We don't tell you we're going to be here such and such date. We go back and forth with, here are dates that we're available. Are you also available? So it's very much negotiated. And then in regards to, we review typically 10 files or somewhere around there, depending upon how big the agency is, and you know, if they have 10 files, if they're, you know, those kinds of things we negotiate too. You get to choose your very best files. We don't mandate which ones we're going to look at. And so that's also good news for agencies, because you have the power to say which files we're going to look at when we're there. So, and which individuals we're going to interview when we're there. So you get to pick the cream of the crop, the folks that are going to report well on you, and the files that look their very best. I hope that answers the question.
I think so, and that's in line with the way most states do it. You know, that question makes me feel like I need to just kind of put out there that fidelity reviews aren't gotchas. They're not audits. You know, these are literally fidelity reviewers coming in to help understand how you do the work of IPS and provide you with recommendations on how you might be able to do it to get a higher score and have a better alignment with the model. You know, there's not penalty discussions. There's not any sort of financial payback discussion with IPS services. These are designed to be, think of it as technical assistance for your organization, 2-day technical assistance for your IPS program. So I really encourage people to, you know, ask questions like this. If they're in your brain, if you're, you know, if they're bubbling around in your head, I mean, ask them. That's what we're all here for today. But the goal is, you know, by the end of a fidelity review, you feel like maybe you have a little bit better idea how you could improve your services, improve the quality of your services, and increase your score over the next 12 months. So, you know, nothing sinister about the fidelity reviews.
Yeah, it's intended to be a very helping process and supportive process. And in fact, and I think a lot of states do this. In the state of Washington, Darren Paskey and I are trainers, and I've seen a couple of comments that say we're struggling, we're just starting, we're whatever. Reach out to me or to Darren, and we'll provide customized training to help you get your feet underneath you. It is very much a supportive process because we want everyone to succeed. And so, you know, the help is there if you want it. Reach out to us.
And I would add as a footnote to that, if there are specific things that we need to have another session like this about, certain portions of the fidelity scale, certain fidelity items, or certain things that people are struggling with, just like we talked about job development earlier, you know, get those to Dawn, and Dawn and I talk regularly enough that if there's something I can do to help. I mean, I'm happy to do another one of these that's on very specific items. That's actually that's the genesis of how this came to be today. Is Dawn and Darren did some Fidelity reviews, and we kind of noticed some patterns, and I think we talked with providers and just said, would you be interested if we did a couple specific sessions? And lo and behold, here we are today. So, you know, ask for help if you need it, or even if you think you need it. That's why we're all here.
Thank you, Paul.
No, thank you, Dawn. It always works best when it's collaborative. When in places where IPS is not collaborative, either between providers or between providers and like state organizations, it just gets it's very difficult to get things done and to help people. It's very, very challenging. So we have a couple comments here. IPS supervisors need to be hands-on and work alongside the employment specialists, and I totally agree. And then another comment that they're just hired for the employment role and really building it from the ground up. Great questions, or great statements, I should say. Again, I really encourage you, for those that feel like you're new to it and you're really struggling to get it set up, that ipsworks.org website literally has a playbook for implementing IPS that you can print off and you can follow it step by step. You might have to kind of tailor certain things to fit your organization or fit, you know, your particular circumstances, but they have made it just refreshingly easy to obtain the playbook on how to do IPS. And every time you hear me talk from now to infinity, you'll probably hear me talk about the ipsworks.org website. And if you don't get the hint, go look in the document library. It is worth it. It will be worth it for you, I promise. One last question here. Catherine puts in here, let's see, is there a place where we can see an example of how the IPS tracker should look? Again, ipsworks.org has some, I don't know that they have an IPS tracker, but they have, for example, and I have it later in this slide deck, data points that should be collected for good fidelity. I'm also going to show you an example of an IPS fidelity tracker a little bit later. And then I'm really kind of focusing on your phrasing when you say how an IPS tracker should look. I try not to be prescriptive because I can't tell you how your agency needs to do IPS. I can tell you which data points you need to collect and that sort of thing, you know, for fidelity. But at the end of the day, you and your organization get to decide how your IPS tracker should look. And it may be, if you're in year one, that your IPS tracker focuses on certain items that you really think are priorities. And that in year two, once you've got those initial priorities solved, you have changed your tracker up a bit to track different things. And neither of those are wrong. And there's not any, there's no prescription I could share with you. There's no certain format that will guarantee you all of the points possible. There's just not anything I could share with you that's the way you got to do it and the only way you got to do it.
I will share too, Paul, that I can send out when I do the thank you email. I worked for an agency that was one of the best grant sites, which was a precursor to foundational community supports and IPS here in the state of Washington. And Melody Pazolt from the DBHR developed a tracker related to participants and some of the dates that you need, things like when did they enter, when was first employment specialist contact, when was first employer contact, you know, what jobs have they gotten, first job, second job, third job with wage and date and title and all those kinds of things. On one tab, it's an Excel spreadsheet. And then on another tab in the Excel spreadsheet is a job development log that allows employment specialists to enter who have they talked to, date, follow-up, that kind of thing. So it's not a tracker of IPS as a whole, but it's got a lot of the things in it that you would want to track kind of in one document that makes it so much easier for employment specialists, supervisors, and frankly, fidelity reviewers to look things up when they come. So I will attach that to the thank you for attending. You are free to, as Paul said, it needs to fit your agency's needs. So you're free to modify it as needed. It's just an example.
I appreciate you chiming in on that, Dawn. You know, there's a follow-up statement in the questions too that Catherine says, I think that might be a harder part of IPS is that there aren't, you know, uniform concrete examples. And it's true. That is one of the hard parts. And I think one of the challenges is each agency is different in their own way in their ability not just to collect data, but also to like in composition. So some places have an individual IPS supervisor, some don't. Some have another, let's say a director of clinical services who's functioning as an IPS supervisor. Some have a quality assurance department that takes care of tracking the data. You know, and so it's really different everywhere you go. And the only common thing is what is tracked. There really isn't any common how to track it. I keep thinking that at some point IPS Works is going to come out with, you know, an app or some sort of gadget that makes it easy for all IPS providers to track in the same sort of system. And maybe that's wishful thinking, but you know, that is one of the challenges for sure, is that there's a lot of telling you what to collect, but not a lot of telling you how to collect it. So I'm with you. You're not alone, and I'm sure there's many others on the call that agree as well. If we move into the next section here, agency focus on competitive employment, in the Fidelity Scale, there's a couple easy things here that you don't really need to track if you're an IPS supervisor. As an IPS supervisor, maybe you need to be able to point to them or that sort of thing, but tracking isn't necessary. So if you just read through it, the agency intake includes questions about employment, questions about employment on all annual assessments or treatment plan reviews, displaying written postings about IPS, supporting ways for clients to share work stories. And then last one is really what's worth talking about, I think, here is that the agency measures the rates of competitive employment and shares it with all leadership and staff. The scoring methodologies, like others we've heard about, points are awarded on a kind of per component basis here. And the best practices for rates of competitive employment and tracking it and sharing it with all leadership and staff really end up being to align that competitive employment stat with the agency quality assurance. Most organizations that have quality assurance programs that are robust, what they do is they kind of put this in the QA report for the IPS team, and then it seems like those organizations also, once they've completed their QA documentation, some version of those QA reports, maybe it's a scorecard, maybe it's the actual QA data, goes back out to organizations, to the leaders, to all the staff. And I think for most accrediting bodies, there is some requirement that the organization shares. It's not always called quality assurance data, but that the organization shares kind of like how we're doing with the staff, all staff at the agency. So that is really how they do it. So in terms of collecting the data, though, what I always tell organizations that struggle with this is talk with the people that are in your like billing department or the people who are in your registration department. Often they are collecting data about employment when a client comes to visit with some regularity. So it could be that a new client certainly gets that demographics filled out where there's a measure of how are they competitively employed, but also I know at my organization and several others, periodically in the year, like maybe it's every 6 months, they have to kind of double check that data. And so you can work with that demographic type data entry group of people. If you have an electronic medical record, you might be able to pull out a report that tells you at any given time, based on what we know today, the rate of competitive employment and this is an important distinction in this item, it's for all clients at your organization, not just those working with the employment team. So I know that one is, that can be a lot to think about for some organizations. So, so if you have a question on it, please, by all means, shoot it to us. But it's important in the Fidelity Review Manual, it's very clear that you should be measuring the rate of competitive employment for all clients, and you should be sharing it with leadership and staff. And one of the challenges agencies have is, first, their ability to measure the rate of competitive employment, and second, their ability to share it. So let me just stop for a second and check in and see if people have questions about that specific one, because that's really, one of the things I think really occurs to me about this one is it is not always in direct control of the IPS team. They maybe have to tap on the shoulder of another person at their organization. So I want to be sensitive to that and just kind of take a second and see if folks have additional questions on how you could get that data out of whatever your system is, and then questions on ways you might share it with leadership and staff. So we'll just spend like maybe a minute kind of waiting on. I'm not seeing any come through, so I'm hoping that folks are kind of picking up what I'm putting down there. Talk with a lot of providers who they really just are baffled with how to even start collecting that data. So thought it was worth spending some time on. Now, in executive team support, that's the next item. I tried to, in this part of the presentation, just really tried to start underlining the parts that are really worth focusing on the data collection, because some of these components really get, there's several of them. So in this one, we're wanting the executive team members to demonstrate knowledge of IPS, include in the QA process a review of components of the program at least every 6 months. At least one executive team member participates in the IPS steering committee. The agency CEO and executive director communicates to all agency staff how IPS supports the mission of the agency, and the IPS supervisor shares information about IPS at least twice a year with the executive team. So real quick question back on the last slide. Somebody, Catherine mentioned, so if a coworker mentions that their client who I don't work with gets employed, I need to track that on the tracker. You can, Catherine, you don't have to. What I'm suggesting is most organizations have to collect some level of demographic data, and almost every agency I've ever been to has to collect, whether it's to be able to bill for services or whether it's because of some sort of accrediting, regulation. They have to collect certain information when people present to the agency, and often what I'm suggesting is often that information that you're already collecting at your organization contains data on employment for all clients. And so if there's a way that you can mine that data to get to a number of competitive employment for your entire organization, that would be the easiest because you're already collecting it. If you can't do that or you don't want to do that, there's a lot of other things available to you. You could rely on conversations like you're talking here. You could send out a, let's say, monthly or quarterly email or paper survey to all staff, asking them to give you the number of clients competitively employed in the community, and you could get that data and put it in a report and say, this is what we heard from our staff. You could get, there's all kinds of different things you could do. There's places that have, when you go to the waiting room and you're waiting for your appointment, they have a tablet that you're issued, and you're administered via the tablet things like a patient health questionnaire, PHQ-9. You could put something in there for the clients who are in your office and waiting that says, are you currently employed, yes or no, and get that. There's a lot of ways you could do it. I'm just suggesting most agencies that I'm aware of already collect this data in a way, and I don't think you'll ever know down to the minute who's employed and who's not in your organization. Some organizations see thousands of people, right? You'd never know, especially if they only come in once every month or once every 2 months. So what I'm saying is if your agency is already collecting the data in that demographics place or registration place, just use that if you can. It's easier on you, it's already collected. All you have to do is find out a way to pull that data out of your chart, whether it's an electronic chart or a paper chart. That's what I'm trying to say, Catherine. Your example of if a coworker mentions that their client gets employed, do you need to track it? To me, that sounds like it would be an awful lot of you running around trying to track that, and probably cursing at Paul for even suggesting it in the last webinar that you attended. So I don't want you doing that to me. So make it as easy as you can on yourself to get the data. That's really what I would suggest. So back to executive team support. So points are awarded per component here, and we're really focusing on the underlying components. So the QA process includes a review of components of the program, one executive team member participating in your steering committee, and the IPS supervisor sharing information about IPS at least twice a year with the executive team. So the IPS supervisor statement and the executive team member participating in steering committee, those are easy. We've talked about it before already. Meeting agendas, meeting minutes. Meeting agendas and meeting minutes tell you when you met, they tell you the frequency of the meeting, and they tell you what you talked about. Those are the easiest ways that you can control this data, and I would say you either save them electronically, and during your Fidelity review, you either show your computer to the reviewers or you print them out, put them in a binder, and you've got, let's say, 10 to 12 months worth of data on every time the IPS supervisor met with the executive team and what they talked about. And you flip to the next section and you've got all your steering committee meeting agendas and minutes and who attended and the frequency. If we move over to the QA process part, now I talked in the last one about the rates of competitive employment and sharing it with all leadership and staff, and how aligning data like this data with the agency QA can be beneficial. So in this example, if you chose, let's say, just competitive employment, you already know you have to track it. If you can get it into your QA program at your organization, and if your QA program at your organization goes out to all staff, you're going to be able to cross off this component in this item, and you'll be able to cross off this component in this item with one thing that you've done. The Fidelity Scale, the Fidelity Review Manual, I should say, it doesn't say what you have to measure in your QA report. So you can choose to measure whatever you see fit and whatever works for your organization. If you measure of competitive employment for your organization enough, and especially if your QA is happening, your QA reports are happening at least every 6 months, you should be fine on both of these items with that one solution. And that's what I mean when, if we go back to the beginning, I talked about making it work for you. It doesn't have to be, IPS Fidelity doesn't have to be a mystery. It's the rare service we provide where you've literally got a playbook that tells you exactly how you're going to be evaluated at the end of a 12-month period. So again, I'll plug ipsworks.org and their document library, and specifically their Fidelity Review Manual. Get in there and take a look, and when you have questions, read what the Fidelity Review Manual says, because it's really, and I'm sure Dawn would agree, it's what the Fidelity reviewers lean on when they have a question. There's not another source of information, a secret source of information for Fidelity reviewers. So if you know how you're going to be evaluated, and you have multiple examples of ways that certain scores can be achieved, it really does help demystify the entire Fidelity process for you. So now we can talk about the third section. Let me check time. Okay, we're doing good on time. We can talk about the third section, which is services. And this is the section probably that's got the most intensive sort of IPS supervisor documentation in it. All the rest that we've talked about so far is really focused on things like, you know, have meeting agendas, have meeting minutes, and those are fine and dandy. This is more of the nitty-gritty sort of, what do I need to have my thumb on the pulse of on a daily basis for an IPS supervisor? And you know, I know we're coming up on another break for lunch here, so so we'll see how far we get, but we should be good on time. So the first one I'll talk about is rapid job search. And so this one is really the assessment and the first face-to-face employer contact occurs within 30 days after program entry. So the first thing I always tell people about this is you need to understand what program entry means for your organization. I've worked with organizations who say it's the first time that a client comes to the agency. I've worked with other agencies that say it's first referral date to the team, but the Fidelity manual is pretty clear that the client first meeting with an IPS employment specialist is where we kind of start this clock. First thing is you should know as far as scoring methodology, and I'll talk about the rest of what's on the screen in a second. If you don't track this information at all, you can't get higher than a 4 on this item. So just tracking it will help you get a higher score. It's really difficult to pin down if you don't track it. That's why this language is there. So the scoring methodology is a median number of days to the first employer contact. And so they calculate that, the Fidelity reviewers calculate that and they score it. So this is a point where I would suggest Microsoft Excel or Google Sheets. You would have to track client name, first meeting, you know, that's in one cell. First meeting with employment specialist is a date in the next cell. The third cell then would be first face-to-face employer contact, and then you'd have a fourth cell where, if you're really slick, you'd have a calculation. And if you're not familiar with Excel or Google Sheets, you can put formulas into cells, and I would put a formula in there that subtracts the first employer contact date. So that subtracts the first contact date with employment specialist from the first face-to-face employer contact to find the number of days between face-to-face employer contact and first meeting with employment specialist. Then what you'd be able to do is, if you had 20 people on your caseload, you could take that whole column and just do you could do the median at the bottom. You'd be able to do a median there with a calculation in Excel or Google Sheets, and you could just let the software do the math for you. I joke with people all the time that I got into this field. I was a psychology major, and then I went and got a degree in counseling because those were fields that would allow me to not ever have to take math classes. And now here I am talking about IPS employment and how to calculate a median. So big fail for Paul there. But median is an interesting thing. If you haven't worked with median before, it's different than an average. So just when you thought you could avoid math, right? There are Fidelity items that use a mean, an average, but others utilize what is a median. And why is that? So these are, if you don't know, even though I say I don't like math, I do kind of like math. These are measures of central tendency. And before you start to fall asleep on me, they're important because they show how numbers relate to each other. So the mean or an average, we all know what that is. You summarize values for a data set, right? So you might do things like calculate an average age of a group of people, or you might take certain jobs and calculate what the average salary is, right? Just to get an idea of what maybe something in the middle is. So if you see here, these numbers I have listed, 4, 7, 15, 23, 31, 45, 81. That's just a string of numbers I randomly put into my slide deck here. The mean or average of these numbers is you take them, you add them all up, right? And then you divide by 7. And that average is 29. What's different about the median, when you compare it to the average, the median is actually used to find the middle value of a data set. And this is important if you're trying to rank values or really trying to identify the middle. And the advantage you get with a median is you get to kind of not disregard, but there's less importance put on a very high score or a very low score. So you see already that the median of the same exact string of numbers is 23. It's 6 digits lower than the average. And that's because the average factors in 81 and 4. Much in the same way, if you asked what's an average of 1 and 100, it's 50. But the median may be much different. Well, not in that example, but long story short, it gets you a truer middle of the data set without getting it skewed by very, very high numbers or very, very low numbers. So it's just a different way to calculate. And I only bring it up, and I know we all love math, but I only bring it up because it's an important distinction to make. I've been to organizations where the IPS supervisor thinks they're doing great work, and they're averaging the number of days between first contact and first employer contact. And it's not always bad. They're not always above 30 when they do it that way. But if you're doing any of this work right now, you probably know and agree with me that for whatever reason, lots of circumstances, certainly there are certain clients who, for whatever reason, you can't get it all put together within 30 days. Maybe it's a little bit longer. Maybe it's 41. Maybe it's 80. Maybe it's 90. And so those are numbers in an average that are really going to throw off your number. So just important to kind of pause here and think about the difference between average and median and why it's important. So now, like I said, I'm a counselor, so let's do a debrief after the math. Does anybody need to talk about math or why it's terrible and why we're all in the fields we're in because we don't like it? But really, in all seriousness, do you have questions about the way this item is calculated or how you could set up this calculation yourself? And so I'll just wait a couple minutes here for folks to ask questions. This is one of the items I'll put out there. This is one of the items that new IPS supervisors seem to regard with the most mystery. So I just wanted to make sure we spent a little time on it.
I'll joke too and say you just traumatized me, Paul.
Well, I knew there was a risk in doing it, but I didn't want to gloss over it. It's important enough, I think, to just the counselor in me says, you know, we need to put it out on the table and talk about it.
There you go. Yeah, I too, I have a degree in social work, and there was very little, well, except for statistics, which,
Yes. So the first question is, can you help us set it up? Are there other questions about mean or median? I can't guarantee that I can make the math easy, but I can show you how you might set it up. And we'll talk a little bit later after break too about how high performing organizations really lean heavily on like a Microsoft Excel type set of data points for their employment team. And I think I gave the example earlier about, each employment specialist manages their own lists and data points in Excel, but most of those agencies then have the employment specialist send that to the supervisor once a week, whenever that is. Some it's Friday, others, send it to me before our supervision or whatever. And then the work that the supervisor does behind the scenes is takes Dawn's and Jill's and Mary's sheets and the data on those sheets and merges them into one master sheet so that the IPS supervisor can identify, not just by employment specialist, but by the entire team, where the data points are trending. We got a little bit of time for other questions before we break, if folks have another question. Otherwise, if you get it in and we break after that or before that, I can always start up the next session with or the next after break session with answering the questions or responding to the questions that have come in. Dawn, do you have anything you want to add before we break for lunch?
Not that I can think of, but thank you. I will mention that I've given out my email address. Darren is actually going to be on after lunch to be able to answer Washington specific questions or to provide or to take down any forms and things that people might want to have. So
Okay.
I'll be leaving for now, and then Darren will be on it from 1 to 2. And so I thank everybody for their attendance and participation.
Okay, this is probably as good a time as any to break then. Dawn, thanks for joining. I appreciate all your help. You always make it easy on me.
Good. That's the hope.
And let's do this. We'll go ahead and break. And I believe it's an hour for lunch, so I will see you all on the other side of the break, and have a good break.
Thank you.
Okay, we got a few more minutes here until we're going to get back started. I think I can kind of see we're waiting on just a handful of people to kind of head back in. While we're kind of waiting for the break, one of the things we had mentioned was, well, one of the things we were talking about was how to score. Let me go back. I don't think I'm screen sharing. Hang on one second here. Okay. One of the things we had talked about was this slide here, and it's for rapid job search, how you calculate the score using a median. We had a handful of questions regarding the median and how to calculate it and so on and so forth. So once we hit the hour, we got about 2 minutes left. Once we hit the hour, I will, that's where I'll start. So we'll just wait a few more minutes. Okay, everybody. I think we're going to go ahead and get started. I was mentioning a few seconds ago, just while we were kind of getting ready to head back in, that prior to the break, we were talking about the rapid job search item in the Fidelity Scale. And so we talked a lot about how that is calculated as a median instead of a mean. And I'll go back one slide just to kind of put it all up there. So the idea with the median is that you get more of a picture of the middle of a set of numbers or a string of numbers with less skew of the maybe a super high number or a super low number. So that's kind of the science behind why a median is used. And so then we went through this slide here, and I'll just kind of leave it up for a couple minutes so people can kind of go back through it. But the idea is, so basically this is showing the difference between the mean or average and a median. So we're just going to leave that up for a second. And so I think, to be fair, I think I traumatized everybody by doing math in an IPS webinar, and I apologize for that. But I think we all agreed that it was probably worth taking a look at. And so one of the questions I had on break was, can you help set it up? And so I did a little messing around on break. And so what I have here is Microsoft Excel, and I have the same exact numbers plugged in that we had on our spreadsheet or on our slide deck here. So 4, 7, 15, 23, 31, 45, 81. So same exact numbers. And if you remember, the average or the mean was 29 of those numbers and the median was 23. So the first thing I'll tell you is if you're going to use Excel or Sheets and you're going to do a formula, first of all, you can do formulas with this little widget right here. If you click here, there's a pull down. You can do sum, average, count numbers, max, min. If you click more functions, there's a ton here. And what is interesting is median is not listed. But if you click, if you can type like I can't, click median, So one of the functions you can choose is median. And so you see this down here, this formula really ends up being median, and then you open parentheses, you do the string of numbers, close parentheses. So that's what we're gonna do. And I'll show you how to do it. I'm not gonna go through all of that mess. I'm just gonna enter it in here. So you start a formula by using equals, and we're gonna do median. I really can't type today, I'm sorry. Median, we're going to open the parentheses, and then all you do is you just select all of these numbers, close the parentheses. So that's the formula. I'll leave it right there so people can see it. Median equals median, open parens, highlight the data, close parens, and then when you hit enter, what happens is it automatically creates the median for you. And so I did in this column here, I thought, well, these were in order. I'll try it over here and see if it can do it when they're not in order, and you'll be happy to know that when you do the same exact thing for the same exact numbers in a different order, median, open parentheses, data, close parentheses, and you hit return, oh, darn it. There we go. And I'm going to get rid of the median. You might have, let's see here. Client name, date of first ES contact, and then date of first employer contact. So this is how you might set it up. First of all, I gotta wrap text to get these looking the way I wanted to look, and I didn't put it in the right spot, so I'm gonna move that out of the way. Days to first employer contact. So this is, my goodness, my spelling. What's going on with my fingers here? Days to first employer contact. So you would have here, like, you know, whatever the name is, and you'd have whatever the date is, X, and then you'd have a second date here. And for this column, I'm gonna just kind of move these numbers. I'm gonna keep moving them over a little bit. Actually, I don't think I need them right now. I'll just show you an example of how it could look. What if we did 9/26/20, and then what if we did 9/30/2020? So these are this is, you know, what you're entering in your spreadsheet, your IPS supervisor spreadsheet, or it's what your employment specialists are collecting for you. So you know how to do the median. Now, what you'd do here is you would do, let's see here, you would do this date minus this date. And so equals starts the formula, and I just click on the cell and click on the cell, hit enter, and it auto calculates for. And then you'd have all of these, you know, as fields that were completed and filled in. This row that I'll put in, let's say gray, that'll auto calculate days for you. And then down here, you could have median. And you could just, even if you had 1,000 values there, you could still do the same formula. And so at any given time, you could have this on your IPS Fidelity tracker, and you'd know date of first contact, date of first employer contact, and the days to first employer contact for that client. And you'd know for the entire population there that you're tracking, the median, and that might be something that you know, just to cue yourself or whatever, you just type, you know, median there or something like that. So you, at any given time, you could make this calculation and you'd know whether you're headed towards 30 or above, or whether you're, you know, below 30. So 23 is good. It's got to be 30 or less. So let me stop right there and see if people have questions for me about any of these calculations. I know you probably didn't think you were going to sign up for an Excel tutorial, and I didn't think I was going to give you an Excel tutorial, but here we are. Oh no, suggestions I would make to people would be, like I said earlier, YouTube is your friend. Use YouTube. I gotta hurry up and there we go, plug in. YouTube is your friend. That's an easy way to learn how to do some of these calculations. I'm gonna mute real quickly. I've got to plug in my computer. So I'll wait for your questions on any of those calculations. Okay, so I got one person saying that helped. Happy to do it. You know, keep in mind the source. I'm a counselor and an IPS guy, not an Excel guru. So your mileage may vary, but that seems to be what works for me. And I'm sure somebody super intelligent on the call, much smarter than me, knows even an easier way. So use your friends and the people that you work with. If you have anybody that you work with that's in like the finance world, like a accountant, CFO, you know, that sort of thing, those folks typically have some super Excel muscles that they can flex for you and show you how to set tables up and things like that if you need to do it. It could be very slick if you get the right people involved. Let's put it that way. So let's go back to our slide deck. We talked this to death, I think. So we've already talked about the math. Another item here is job development, frequent employer contact. So we talked about this a little bit earlier. We talked about how, you know, there's outcomes associated with job development in particular. So each employment specialist should make 6 face-to-face employer contacts per week. And so what you're going to need to do as an IPS supervisor is know where they're at related to the 6 per week. And then also in a Fidelity review, they'll ask to see your IPS job development logs, and they'll do it too. The scoring methodology associated with this item really is they review the log for 2 months. So when a Fidelity reviewer comes in, they really take the total number of contacts and they divide it by the number of weeks. And that, as you learned a couple slides ago, is just an average. And now you know how to do that. If you wanted to put that calculation in your spreadsheet, instead of using the word median in your formula, you would just use the word average. So equals, average, open parentheses, put your data in there, close parentheses, hit enter, then you've got an average. And again, the best practices here really end up being like some form of this Excel spreadsheet or Google Sheets. There may be some agencies that have the ability to do reporting out of their electronic medical record. So for example, for organizations who, let's say you bill for your job development, then there should be a note for anything you've billed in your electronic medical record. And most EMRs have the ability to kind of do a report based on number of notes. The problem with that is unless you've got a special service activity just for job development, you're going to be sifting through all the rest of your notes too. And so that may not be the best, but places I've seen an EMR report work really, really well were organizations where they literally had a a service activity that was called job development. And so they could pull based on that service activity only. They could pull a report based only on that activity. And that worked really well for that organization. But I've only seen it at that organization, so it must not be something that is super easy for all of us. Now, if you go to the ipsworks.org website, and you've known me long enough today, and if you've attended the other sessions, you've probably heard me talk about that same website in those sessions as well. It's got a whole document library filled with things that we're talking about. It's got sample employer contact logs, sample job development logs, for example. And that's the one I have on the screen right now. One of the things I'll tell you about this one, though, is, and again, this is maybe nitpicky, but from a Fidelity reviewer's perspective, this is, so remember, the Fidelity reviewers are looking through 2 months of logs. And if you have 2 employment specialists and 2 months of logs, and we're looking for 6 contacts a week, real quickly you can see how that would be kind of a bear to flip through all of these, count them up, et cetera, et cetera. That's really the advantage to having some sort of spreadsheet that you can point to. For a log, not to say this is bad, this is great. If you need to start somewhere, this is a great place to start. It allows you to track, you know, whether you're on your first, second, third, fourth visit, ongoing relationships. It's got notes. I mean, it's got all kinds of great information in here that you could use. It's just, like I said, from a Fidelity, you'd have to think about a way to show the reviewers in a Fidelity review that your employment specialists are hitting 6 per week is just really the thing to think about. Diversity of job types. So this is exactly what it sounds like. It's, you know, the idea is, in principle, the employment specialists are helping clients get different types of jobs. So one of the things that the Fidelity reviewers will request from you, either at the visit or prior to the visit, is a list of job types for the working clients. So you're going to put on there, you're going to put on this list, you know, custodian, teacher, daycare worker, just the type of job that people have. The kind of tricky part about the scoring methodology here is if the job's listed 3 or more times, you wouldn't count the third plus times. So if it's counted 4 times, you'd only count time 1 and 2. And then the way they arrive at the scoring for this item is the number of diverse job types is divided by total jobs, and that corresponds to the scoring item here. And again, Excel spreadsheets, Google Sheets, I've seen people do this in Word, and one of the challenges with Word is, you know, you don't have kind of like the automatic format that like individual cells give you. It's not good or bad. I've seen Microsoft Word trackers, but I've seen more Excel spreadsheet or Google Sheets trackers than I have Microsoft Word. So again, you have to make it work for you. And just what I'm saying doesn't mean it's the answer for your organization. That's something you've got to develop if you don't have it already developed. So for example, here we have a handful of different job types. So let's see here. So I already saw a mistake I made here. And if you see the mistake I made, please feel free to put it in the comments. If I had a candy bar or something, I would give it to you if we were in person. So we've got stocker listed 3 times, housekeeper, librarian, cashier, driver, cook, dishwasher, clerical, assembler, warehouse. So, you know, pretty robust look at different types of jobs. There's 12 total jobs. Stockers identified 3 times though. So here's my error. I put 9 diverse job types. I don't know what I was thinking when I put this together, but I discounted 3 stockers, and what I should have done is discounted 1. If you remember, 3 or more don't count. So you count the first 2 stockers, but not the 3rd stocker. And that would be, let me get out my calculator, because as you all learned earlier, I'm not good at math, right? That's why I'm in this field. 11 divided by 12 is 91.6 or 92%. So that's how they would calculate that. And you could see where having things just laid out in a table like this would be really helpful in Excel or Google Sheets. Diversity of employers is really similar. It's something the IPS supervisor needs to track. And this is, instead of job types. This is diversity of employers, so actually where your folks are working. And we want to get people to get jobs with different employers. We don't want to have all of our folks working for the same company. That's not good diversity. So we're gonna provide a list of jobs for working clients. If an employer is listed 3 or more times, don't count that third time. If it's counted 4 times, don't count the third or fourth time. The number of diverse employers divided by total jobs is how they score the item. And again, Excel and Google Sheets really are what I see people using here. Again, it just needs to work for you. So if you've got another method and it works, great. Don't argue with success. You don't have to do any of these things that I'm mentioning to you. These are just tips. And so in a similar way, if you look at the diversity of employers, here's a fun one for you guys to enter into the question. What do all of these employers have in common? That's a good one. If anybody gets that, I don't know what I'll give you, but I'll give you a high five maybe, the virtual high five. So we've got all these different employers and 12 total employers. You got Bob's Burgers identified 3 times, and I must have been, I hope I wasn't like doing this during the debate last night. Good gravy, here's another mistake. So Bob's Burgers is identified 3 times, and so you don't count the third one. So it should be 11 divided by 12 total jobs for 92%. And I don't see anybody identifying in the questions area the common theme between all of my employers here. I'm going to give you just a minute to review those. All right, we got somebody who's answered. Customer service with a question mark, Rodnisha. So that is technically true, but not what I was looking for. So you get, I don't know, partial credit. Thank you for playing. You get the home version. Anybody else brave enough to give it a shot? All food related. Again, close, but not quite. Comedy TV shows, and they're all from TV shows. 2 people, now don't judge my TV. I've already gotten some comments on that. Thank you very much. And I had my wife help me for the record. So you judge ours. So yes, they're all restaurants from TV shows. Well, I guess they're not all restaurants from TV shows. They're all companies from TV shows. So Mesa Verde Bank is Better Call Saul, Los Pollos Hermanos is Breaking Bad, Moe's Tavern is The Simpsons, Bluth's Banana Stand is from a show called Arrested Development, Dogs Bounty Hunters is from the show Bounty Hunters, or Dog, I think is what it's called. Sir is I think it's a bar / restaurant that is owned by Lisa Vanderpump from Vanderpump Rules. Dunder Mifflin Paper is from The Office. Schrute Beet Farm is from The Office. Bob's Burgers is from Bob's Burgers. And Rodnisha, I don't blame you for not watching any of those shows, trust me. And the Peach Pit, this shows you all how old I am. So the Peach Pit is actually the name of the diner / cafe from Beverly Hills 90210. So there's some good trivia that you've learned about your facilitator inadvertently. We got another question here. Where's Cheers? That's a great question. I don't know how I left that one off. I didn't have enough total employers. I need to get out there and do some job development at Cheers, I guess. So I just want to check in. This can be brief. So do the diversity items make sense to you all and how they're calculated and how you might track them? And you don't have to worry about the second question here. How would you calculate this? Well, no, we could put that out there. How would you calculate the same employer for employer diversity if it was the same employer at 3 different locations? So let's say whatever the grocery store is, near you, you have 3 people, they're all employed at the grocery store, but at 3 different locations of the grocery store. So I'm curious what you all think about that. Do you count all 3, or do you count only 1, or count 2? Still getting some good answers regarding the TV show businesses. So Jason, for the second question here, how would you calculate the same employer at 3 different locations? Separate locations and different managers, so 3 total. Yep, May says I would count 3. Again, right answer. Count 1 due to being the same grocery store at different location. And then we have would count as 2 if it's the same employer, however, different positions. Someone says 3, and then we've got separate locations and different managers, so 3 total. So this is kind of a trick question. It's really difficult to know the correct answer without knowing a little bit more information. So 3 locations are good. That's better than 3 people working at 1 location in 1 job, right? But some of the decision points for you to really consider are, do the 3 locations have separate hiring managers? Sometimes they do, sometimes they don't. I've seen organizations run into situations specifically with grocery stores where maybe they have a regional hiring manager. So you've got the same hiring manager for all 3 stores. And so that would be something the Fidelity reviewers would really want to explore. Not that it's good or bad, not that they wouldn't award points, but they really want to understand it first. And then, certainly, all of the other questions are versions of accurate and correct too, and that really just goes to show kind of how all of the context is important, especially now with online applications. It's easier than ever for maybe like a regional company that has multiple locations to have all of the applications go into one person who then sorts them out based on, I don't know, somebody's address or where the openings are. So it's good as a reviewer to kind of get that context, and as a provider, it's good to know that context so you can explain it to the reviewer. For time unlimited follow-along supports, this one is one of the complicated ones, just to be real honest with everybody. This item in the Fidelity Scale says that we need to have employment specialists making face-to-face contact within 1 week before starting a job, within 3 days after starting a job, weekly for the first month of employment, at least monthly for a year or more, and then contact with clients within 3 days of job losses. And so really the scoring methodology is this all comes down to the chart review. Reviewers are going to come in and they're going to look at your charts and see if this is happening for the 10 charts you've pulled. So as Dawn mentioned earlier, in a Fidelity review, you get to decide which charts you show the reviewers. So I'm always stunned. I don't know if I'm impressed or stunned or both, but when I get to an organization and they give us the 10 charts and we find, that these charts aren't really showing us the data that would support high scores on items like this, which is why it's important to have maybe some backup data that you can show to the Fidelity reviewers, and that would be, again, no surprise, Excel or Google Sheets data. And I've got an example here actually that might be useful for folks to look at. So I know it looks a little wonky. I had to stretch it to make it big enough for everybody to see, but this is what I was talking about earlier, where there's a Fidelity tracker an organization uses, and they've got, if you see over on the right-hand side here, they've got portions of the Fidelity, portions of the Fidelity, here we go, I can use my highlighter. They've got portions of the Fidelity Scale typed right into the Fidelity tracker. And so again, the employment specialist would be responsible for completing this document. They'd put the client, the hire date, first face-to-face date, when they got the job retention form or completed, when the job start actually happened, and then they've got this, right, just like clockwork, first face-to-face 1 week after job start, when they had the benefits conversation or appointment, face-to-face weekly for first month, and it goes on and on. There's multiple tabs to this particular organization's tracker, but it's a really good example of how you could set it up just by putting some color in the title cells and then just kind of having people enter dates. You could really set up a really robust document that will help you at a glance know if you're getting it done the way you need to be getting it done. This asterisk at the top too, all IPS documents are completed in CareLogic in addition to corresponding billing notes outlining service provided. CareLogic is that organization's electronic medical record. So I thought it would be good too. We're right on time. With the last little portion of our day here together, I thought it would be good just to walk through some of the documentation examples that I have available to me, and then talk a little bit about some of the things that are available to you right now. So this is a document, and it's multiple pages on multiple slides here. So this is actually available at the ipsworks.org website in the document library. And it's data collection and quality improvement processes for good fidelity. And so what it does is it identifies for each fidelity item what you would collect, what data you would collect, or what quality improvement process would be in place, and kind of how often you need to be doing it. And it's a really robust document. It's a really robust document. It's got a lot of detail to it, and so I would encourage you to go out to the ipsworks.org website and take a look through it. But you've got integration of rehabilitation with mental health treatment team. We talked about that today. You've got role of the supervisor here, and so here's in the data collection paragraph you've ever here. Examples of data collected by supervisor include number of job starts for the program and for individual employment specialists, as well as number and percent of people working on the team caseload and individual caseloads. There's certainly more I think we talked about today than just that statement, but nonetheless, this is a good place to start in thinking about what you need to document and what you need to collect. Let's see here, agency focus on competitive employment, and so it's got sample questions in here. Again, it's really robust. Here's page 2 and a link, thankfully. Executive team support, and it talks about how the quality assurance process reviews the overall IPS fidelity score every 6 months until good fidelity is obtained. Let's see, here's another one. Rapid job search, we just talked about that one. Some supervisors track this by asking for information during the weekly vocational unit meeting. That's fine. I think we've shown you a couple examples of how you can make it even more kind of scientific than just waiting for someone to volunteer information to you. And I think what I've seen at organizations with high fidelity is these fidelity trackers they've created really help the team stay on target with what they need to do, because so many things that we are doing are kind of based on a particular date or time frame, you know, et cetera, et cetera. So it's important for you to think about how else can you keep the team going in the right direction. The last thing you want is your IPS supervisor to be spending all of their free time with data and numbers and entering stuff in Microsoft Excel, and the team not knowing how they're doing on any of these outcomes. You want the team to be really well informed of their outcomes. And another page here with some other ones. Let's see here. So it talks about the diversity, and again, it's not every fidelity item, but it's a lot of them, that's for sure. And then it goes into work incentives planning and disclosure. All of these, you know, it talks about how documents are available at this website. Again, it's in the document library. It's all there. It's all there. I wanted to show you another page of that employment, of that fidelity tracker, another tab, I should say, that I showed you earlier, and it's got the same sort of format with that. I don't even know what color that would be, mauve maybe. So this employment specialist fidelity checklist kind of workflow is designed to help the employment specialist understand when they start with a client, what are the steps in everything they're doing. So you've got certainly client, date they did an intake, and in this organization, there's some date that's different between the intake date and like the mental health assessment. Then you've got a vocational assessment column. DISC would be like discovery. ROI would be releases of information if you need any of them. There's a job search plan. JRSP, job retention. Perhaps that's what that is, job retention search. I don't think that's a job retention search plan. At any rate, first face-to-face within 30 days, information on benefits, And then I don't know what CMCC means, but this again, they have to the right a little cheat sheet for the employment specialist at intake. It's 30 minutes and it's billed by the employment specialist. Oh, I know it's CMC. That's a billing code in Illinois. So it has all these little notes for along the way for the employment specialist in case they lose their, place or they forget, how do I bill for this? And it's a really, again, robust document. They've got another, this one's even more wonky, but I think I showed this to you before actually. Yeah, so this is what I showed you earlier. First face-to-face before a job start date, first face-to-face 1 week after the job start, and weekly for a month thereafter. So most of these, when you set them up in Excel or Google Sheets, all you're really doing is putting title fields in the top row, and then the rest is just somebody populating the data. So it doesn't have to have all of the formulas in it if you don't want. You can save the formulas for Fidelity review time and just do it once a year if you want, or you could have it, down at the bottom and it just kind of auto calculates as you're entering data. Here's their version of the outreach checklist, and they've even got examples of outreach over here on the right, which again is pretty cool. It says, okay, here's, in order to go through this list, here's the things you need to do. Again, a really good example of how it's all in one place for the team. And again, if I'm an employment specialist, I update mine daily, and then I send it to my supervisor, IPS supervisor, weekly. They take my data and merge it with all the other employment specialist data for a master list, a master tracker. So again, this is where I started. I started with telling you all, first of all, achieving Fidelity is great work. So if you're in an organization and you've had a Fidelity review and you're in the Fidelity range, kudos to you and your team. You're doing great work. You have Fidelity to an evidence-based model. Don't get down at the mouth about, not having all the points possible. Understand progress might take time. And I told you all last time, I know there's a lot of folks who were on last time, so I'll try to switch up. I won't tell you the same exact thing, but anything we can do to move from thinking about Fidelity as perfect to Fidelity as flexible, I think is important work for us to do for ourselves. It's easy to look at the max score and say, gosh, we're never going to get there. But that's not wrong if you don't ever get there. If you stay at 102 for 6 straight years, that is not bad. That's great. A score of 102 is a great score. You have great Fidelity. That's awesome. So don't get hung up on the numbers. You got to do what works for you. And I always tell providers that every provider needs to kind of make some decisions in the Fidelity scale about what they can reasonably focus on in any given year, because it's a lot to work on all of it. And then B, there are certain things you just, for whatever reason, you can't do. If you need to hire additional employment specialists in order to get your caseloads lower, but the money's not there to hire new employment specialists, you need to move on to a different part of the Fidelity scale. Because your organization today at that time, for example, might not be able to make that happen. So you just file it away, and when you have the opportunity later, you can revisit it. But don't get hung up on it and try to figure out all these different ways where this, that, or the other might happen magically. Make it work for you, because Fidelity can work for you. So I have gone through my content, and I wanted to make sure I saved some time for questions. So we're gonna spend the rest of the time with you guys asking me questions. So the first question here is it taken into consideration if there's limited employers in the area? For example, we have the military and shipyard as our largest employer, lots of jobs within, but the same employer. So great question, first of all, and every kind of region struggles with this in their own way. And what's funny is even in super big metro areas, there's a largest employer, and in rural areas, there's a largest employer. So everybody across the United States really struggles with this, in a similar way. And some of it really depends on the numbers. So it's taken into consideration, is what I'll say. But in that particular section, you're talking about diversity of employers, for example. I'm flipping through my Fidelity manual. While I'm looking through this, folks they're welcome to enter additional questions in the chat. So it says here in the Fidelity Review Manual, IPS specialists can advocate for more than one person to work at the same business, especially in the same departments, but they also discover that the wider their network of employers, the more they are able to provide individualized services. So what the Fidelity Scale doesn't do, or the Fidelity Reviewer's Manual doesn't do, is it doesn't really give any strict guidance on, so let's say you work in an area where the hospital is the largest employer, and that's pretty common. There's a million different jobs in a hospital, you know, from top to bottom. And while if you have, well, we'll just use big, like, whole numbers. If you have 10 people employed and 9 of them work at the hospital, if I'm a Fidelity reviewer, I'm not going to give you good scores for diversity of employers. That is almost everybody working at one place. There is flexibility, however, in the Fidelity Scale. Let's see here. So for diversity of employers, to get a 5, you have to be in the 85 to 100% range of diverse employers. 70 to 84 is the score of a 4. 60 to 69% is a score of 3. So if we just stop right there and still go back to the example, if you had 10 people all working at, and 9 of them were all working at the hospital, that would be a 1, less than 50% of the time. But if you made it, but if it was only 6 of 10 people working at the hospital, you'd score a 3. So it all comes down to the math. There's not special consideration as such in the Fidelity Scale. That kind of washes out in the percentages. And yes, I will send out the PowerPoint at the end here. So now is your time. If you have questions about anything we've covered today or anything else even, I'm happy to answer them. If there's someone brave out there that still has questions about the math that we covered today, I'm happy to do that. I was just excited that people even came back after I talked about math right before lunch. So kudos to you all. You guys are brave. So I will stay on here. I will just keep waiting for questions or comments to roll in regarding any of the content today, or if you attended last week and you have a question about content last week, I'm happy to talk about that as well. I know Dawn and Darren and I have had some discussions via email and phone call about other potential training topics. So if there's a specific topic you'd like us to consider, by all means, that's also fair game to shoot into the chat. Okay, so I've got, so Catherine is saying she's looking for the quality improvement processes file on ipsworks.org. Is that where it's located? So are you, Catherine, are you asking about let's see here, let me get back to it. Are you asking about this long document here, the data collection and quality improvement processes? Okay, so that should be in ipsworks.org. Let me see if I have that pulled up. I think I do. Look at me. I'm with it today all of a sudden. So this is the website, IPS Employment Center. If you go up here to library, you click on document library. I guess I should check in and make sure that you all are seeing what I'm seeing, huh? Yeah, okay, you are. It does take a little bit to transition between screens. Let's see here. I have admittedly not memorized where all this is, but I think it's data and record keeping. It may be. Let me see here. I don't have all the titles completely memorized. There you go, data and record keeping. It was on page 1, right here. There's also, there's a chart review form that folks could look at. I don't find that one to be extremely helpful, but that's just my opinion. The Fidelity Manual is right here. That's what I've been referring to as we've been talking today. what are other things? Here's implementation tips. If you, you know, want to figure out, you know, what other places are doing, it's all based on research they've done. There's steering committee meeting agendas, for example, job descriptions if you need job descriptions. I'm going to flip back over to questions real quickly. I want to make sure I don't miss any questions. So that should get you set, Catherine. And then the Excel portion, so Catherine's asking, and then the Excel portion. So the Excel portion is a fidelity tracker. I kind of asked an organization where I saw it if I could use it as an example for other organizations, and they said sure. So that's something I am bringing to the table today. That's not on the IPS Works website. I think I sent that to Darren last week, and it might have been Dawn. No, it would have been Darren last week. I am not 100% certain on that, but I can check, and I don't think there's any problem with it. It's not proprietary or anything, so I could send out that example of the fidelity tracker with the slides if that's something people would find helpful. And then Darren, if you're out there, we do have one recommendation for doing a like a focused training topic of documentation. And so that might be something we explore in the future. Are there other questions people have? Or is everybody still mad at me for making you do math? I'm joking, of course, but in seriousness, that's what I mean when I say it's important for you to get a look at the Fidelity Manual and understand how items are scored. Not that I am encouraging you to set up your program to get a particular score, but when you understand how they're scored, I think it helps you understand where the flexibility is, and it helps you understand the how of the work. And that's one of the things that all providers kind of identify in their first couple of years is, fine, I have the scale and it tells me what to do, but I have no idea how to start or how to keep it going or, you know, how to get it even to be real. And so one of the challenges is making it real with, you know, answering those how questions. That's okay, May. I see your statement there. So you are welcome to email Dawn, Darren, me. If you're going to email me, I encourage you to add Dawn and Darren on that, because if you email me alone, I'm going to forward it to Darren and Dawn first, and that's just me, you know, maintaining a professional boundary. I think communication needs to go through the people that are bringing me there. So, so I would please add Darren and Dawn, and they know the Washington specific stuff. That's why I say that. I don't want to give you any sort of guidance that is in contrast to what you might be hearing from Washington.
Hey, Paul, this is Darren.
Oh, hey, Darren.
I just have a question to clarify the documentation question that I just heard. Was that about utilizing some of those Excel spreadsheets that you had to collect the documentation on that, or is it more related to medical necessity and the clinical note piece of the documentation process?
That's a great question, and I think it was May that I was going to say May would need to clarify that for us, but May just said both.
Okay.
I think the answer is yes.
All right, that helps. Thank you, May. Thank you,
Yep.
Paul.
Other questions from folks out there? The questions are starting to slow down. And Darren, I don't know if you have any announcements or anything like that you need to make with the time we have left over, or if we're just good to hang around for a few more minutes and see if any other questions come in.
Well, definitely I want to thank everybody for some of the ideas, because Donna and I are looking at what kind of trainings that we need to provide for folks to support the process. So definitely take those into considerations as we look at the training schedule for the rest of this year and into next year. And one of the other good news things to share is that there will be, additional Fidelity reviews coming up for 2021. So we're going to be looking for providers to be reviewers, and for those to do baseline reviews for next year. So definitely, if people are thinking about that, please connect with Dawn or myself so we can start that conversation now and plan for next year.
And just on that note, Darren, I know Dawn and I met yesterday, I think it was, and we tried to draw a circle around some dates for additional Fidelity reviewer trainings before the end of the year here. So that'll be another opportunity when those dates come out for folks to sign up if they'd like to learn about Fidelity reviewing and becoming a Fidelity reviewer.
Great, that is good news. Don did share that piece with me, so thank you, Paul.
And then it looks like we have one more question, and this one might be Washington specific. As Teresa is saying, she's having issues with finding benefits and incentives training in Washington State. And she added to it, WISE is supposed to offer, but it doesn't sound like until mid-spring. And so I don't know Washington specific answer. I will tell you just from my perspective, many states have a very small number of trained benefits and specialists, and so there's either a wait list or agencies have had to resort to having like a one day a month where they line up all of the clients who need benefits planning and just have a half day with the benefits planner they're assigned to. So across the United States, that's kind of, I think the benefits planners might be in short supply across the United States is my hunch, but Darren, I don't know if you know anything specific about Washington.
No, it's in Washington too, as just with COVID and programs and agencies have had to reprioritize staff that they have. We've actually seen some agencies lose the trained benefit planners. So definitely I know that's a deficit in Washington State. We just did a training at the Foundational Community Supports conference that we had at the beginning of September, and we're able to have different individuals discuss benefit planning with Stephen Kozak with DSHS discussing HWD and some other incentives. So I'll see if we can have some additional information maybe sent out with this, the PowerPoints and the Excel spreadsheet to the group for some additional ones. There are some trainings, but they're at Cornell, Virginia Commonwealth, and some other vendors, and WISE, and that's pretty much of the resources that I know of. But I'll talk to Dawn so we can add some additional benefit information to this presentation.
This is Dawn. I was actually afraid to hang up because I was afraid that I would disconnect the webinar. So I've been sort of not. Sorry. Teresa mentioned WISE training, and we actually paid WISE to do a series of trainings that are recorded and on the Pathways to Employment website. 4 2-hour trainings related to benefits planning. It will not make you a benefits planner, but it will give you the basics so that you have an idea of what you're doing. So if you look at Pathways to Employment, and it is under the Continuing Education tab, there are 4 separate 2-hour trainings, one on SSI, one on SSDI. I want to say one of them's on TANF and Work First and I want to say BFET. I can't remember off the top of my head what the actual titles of them are, but there are 4. And you can access them at will and on your own time. And I see Teresa says she wants to become certified. That, as I think Darren mentioned, would be through either Virginia Commonwealth or Cornell, and there's waiting lists from what I understand. I just recently had information from a person that finished becoming a certified benefits planner I can share with you that information in regards to how to contact and that kind of thing. But she forewarned that there's a waiting list and it's hard to get in.
Yeah.
Sorry.
No, that's okay.
I really
That's
was
good.
afraid. I was truly afraid if I hung up, I would disconnect the webinar. So it's just been running on my phone. I didn't want to add to any troubles that we seem to have with technology by hanging up and have to say, you know, ended webinar for all or something like that.
Knock on wood, we've been, you know, gremlin free today. So.
Indeed, we have.
Are there other questions from the group? And since we know Dawn and Darren are both on, you can certainly ask Washington specific questions too.
So I have to be very honest, and I did tune out for quite a while, just left things running. So if there's other, when we do the thank you for attending, I have down that I'm going to send the example of a participant and job development log. I'm going to send a link to the manual. Was there anything that came up this afternoon that also needs to go out with that thank you email?
I'll probably send you, like I usually do, Dawn, the slide deck, and we reviewed a Fidelity tracker that I'll send to you that people can look at.
Okay.
It's an Excel spreadsheet. They can, you know, it's not proprietary. They can modify it to be whatever it needs to be, but it's an example of how they could track some supervisor data.
Wonderful. Thanks, Paul.
Happy to do it. I don't see any other questions coming in, Dawn and Darren. Do you feel like we want to give people the gift of about 6 minutes to their day?
Makes sense to me.
That's always a great gift.
It's a great gift. Doesn't come, but you know, a couple times a year. So I just want to say thank you certainly to Dawn and Darren for helping with all of the tech stuff and with the answers to the Washington specific questions. It's always nice to not have to tap dance around those. And then all of the attendees, everybody's been great. I know the web format is something that even though we're, you know, 6 months into this year and all of this COVID kind of mess, I still don't feel like I'm really used to it. So I appreciate that people participate and, you know, be a part of the discussion in the way that we have to today. And I'll just say I'm looking forward to the day when I can kind of get back out there and talk with people face to face and meet you all and give you a pat on the back for the good work you're doing.
Amen.
Thanks for all your good work, Paul.
I'm happy to help in whatever way I can. So if there, oh, May says come to San Diego. Well, we'll have to work that out, May.
Take us, Paul.
Yeah. So my wife just yelled from the other room, yes. So so we, yeah, that's all I needed was my wife's permission, apparently.
That's a good place to start.
Yeah. As they say, I know what side my bread is buttered on, right? So
Praise man.
Yeah.
Oh dear.
Well, this is as good a way as any to end our time together today. I appreciate everybody's time and keep doing good work. And let's hope that 2020 ends in a nice, calm manner and we can be just great in 2021.
Yay.
Yay.
Thanks, everybody.
All right, everybody. Stay safe. Bye.
Bye-bye.
Bye-bye.